Some people will say, "Oh, what about surgery? I want to do surgery." Now, it's not really encouraged for patients to go through surgery, because if you do surgery, you still need to do radiotherapy and brachytherapy. Whereas you can do just radiotherapy and brachytherapy without surgery, and you'll be fine, except some type of histology. So rectal cancer has different types also. Right, so cancer naturally have different types. There are some cancer that they are mild type, and some cancer that they are very aggressive type.
Welcome to Healthline once again.
Thank you, Laolo.
Yes.
It's nice to be here.
Yes, the first time we had a conversation with you on air, it was virtual, but now we have the opportunity to have you here in person, and which means that if you have any cancer-related question or you're undergoing cancer treatment, you need some clarification, Dr. Oluyede is known as Dr. Glow, right?
Yeah, Dr. Glow.
Yeah.
On the low, I won't go below.
Hey, you dropped the bars. Please say it again.
Don't mind me, in medical school, I just, instead of you, if none of us calling you Glory, can you just shorten your name to Glow? I said, yeah, the Glow is not bad. So they started calling me Dr. Glow with the flow. On the low, I won't go below.
Wow. That's something that,
Yeah.
so I mean, his full name is actually Dr. Glory Oluyede.
Yeah.
And like I mentioned, he is an oncologist. Why is he here today? We know that this is the Cervical Cancer Awareness Month, and we want to learn one or two things about the human cervix, so that we can know how to better take care of it, and we also can prevent and maybe manage cervical cancer, which is a big thing. So in simple terms, Dr. Glow, what exactly is the cervix and why is it so important?
Oh yeah, thank you very much, Laolua. Cervix is part of the organ in female genitals that men don't have, and for a layman, for most of the time when a woman is pregnant, you will see the midwife saying that you want to check whether you are dilated. So they will put hand into the vagina and check. They will tell you it is 2 centimeters. After some time, they will tell you it's 4 centimeters. After some time, it's 8 centimeters. Now it's fully dilated. That part they are checking is called cervix. So we call it the neck of the womb. So we have baby growing up in the womb. So the neck before you get to the womb is called cervix.
So after the vagina,
we have cervix, like the door to the womb.
So after the cervix, then you have the womb.
We have the womb.
Wow. Wow, that is why is it so important? I know it must be very important for childbirth. Are there other importance of the cervix?
The cervix is very important. For instance, for women that are not able to carry their baby to term. Carried baby to term means that when they are pregnant, at a point in time, they can have miscarriage. It means that if that door to that womb is not tightly closed, that cervix is not closed, you notice that they are leaking water and the baby can die from that, get infection and die. So cervix is very important in terms of making sure that pregnant women are able to carry their baby to term. To term means they are able to carry it to 9 months and be able to give birth. That is one importance of cervix. The other part of it is the fact that when one is having sexual intercourse, cervix is important to ensure that anything cannot just get to the womb anyhow. So it's like a sphincter, like a door. When one is menstruating, it ensures that the part of you dropping the blood is not just gushing out. It controls what comes out like that.
So it's like a funnel too.
It's like a cone. If you talk about the shape, it's like a cone, but in terms of its function, it helps to help what goes into the womb and what comes out from the womb. And it's very, very, very important. It's very important to.
So which means that if there's something wrong with it,
then
it can affect what goes into the womb and what comes out.
Exactly.
Wow.
So
interesting. But is it important for men also to be interested in this conversation? Because
Absolutely.
I bragged earlier that men, they should bring the same breast cancer energy. They should bring it to Healthline today.
Absolutely. We want to talk about cervical cancer awareness month. There's no way you talk about cervical cancer without involving the men, because most often than not, what causes cervical cancer is a virus, and that virus cannot just be gotten inside women, like jump inside them. They must have gotten it from somewhere, because it's gotten mostly from sexual intercourse. So
are you saying it's gotten mostly from men?
Most women too can infect men with it. So one way or the other, that can happen to each other. So men can have HPV in them, and during sexual intercourse they pass it down to women.
Hold on, are there other ways for a woman to get HPV?
Yeah.
That's a human papilloma virus.
Human papilloma virus.
That's what causes cervical cancer.
Majorly, 99.9.
So are there other ways for women to get HPV?
Yeah. Because it is gotten through fluid or through blood. So for blood that is not strained, maybe I had a cut or something, or there's a particular practice among the cutists, whereby they will I cut my blood, I cut your skin, you cut my skin, and we begin to exchange blood. Yeah, that kind of a thing. Somebody can get HPV through that. Anyways, one can get HIV, one can get HPV, blood contact or fluid contact. And not necessarily even through sex. Some people can get HPV through oral sex or anal sex, some necessarily vaginal sex. Do you understand? So whether blood transfusion or blood covenant, or whatever practice that somebody has to be drinking somebody else's blood, So HPV is a virus that can come in most of the time through the fluid means. So that's how it's gotten. And it can be transferred from man to woman or woman to men, and both of them causes problem. As in the HPV causes problem in the women, and it also causes problem in men.
But I heard somewhere that HPV is not really detected in men, but it can only be detected in women. That while men can carry it and transfer it, you can't really detect it in them. Is that true?
Okay, so you can detect HPV in any human being that has blood inside them, because there's what we call HPV DNA test. And we are going to get there. HPV DNA test is done to check whether the person is infected with HPV. And HPV virus, this virus, there are different subtypes. There are about 150 types.
Okay.
But the one that is concerned to us are the one that we call virulent. Virulent means that they are able to cause alteration to the DNA of a cell. And they can cause problem. Do you understand? Because all other ones, our normal immune system can clear them. But there are particular type, like type 16, type 11, type 18, 31, like that. They can cause problem. So once you are a man or you are a woman and you have blood running inside of you, you can be a carrier, and it can be detected in you. So it is not that it cannot be detected. What people don't really know is the fact that most people that come down with cervical cancer, they mention that it's HPV. But men come down with perineal cancer, we hardly see them, or they will perhaps not even present. They come down with anal cancers. They come down with oropharyngeal cancer, the cancer around the throat area. So they come down with all other cancer caused by HPV. So if they do test HPV DNA, it will detect whether they have or not. They understand.
So men can actually have that test.
Yeah, it can be detected in them. The question is only in women. It's as if once it enters men, it disappears. But once it enters into a woman, it begins to manifest. No, that is not true. It's because it's going to cause what one can quickly see, like cervical cancer. But men have a lot of that cancer that people don't relate HPV to. Oropharyngeal can be caused by HPV. Do you understand? Anal cancer, and some even have warts. There's this I don't know how to, a flesh kind of thing around the anus. Yeah, growth around the anus. It's caused by HPV. So it's inside them. It manifests. It's just that men, the health-seeking behavior of man is not the same as women. Women want to quickly take care of it, but men say no, nothing they happen. You get. So yes, it can be telling them.
All right. Why do doctors say many cervical problems are silent?
I don't know why they say several cases are silent, except the patient is not presenting in the hospital. I need to clarify this. First, cervical cancer is one of the few cancers that it is preventable, and it's one of the few cancers that is also curable. Preventable in the sense that if you detect cervical cancer now, first they don't come as cervical cancer. For somebody to develop cervical cancer, that person must have been infected with HPV. And for it to alter the cell, the homeostasis, the normal environment of the cervix, it takes minimum of 10 to 15 years before it can turn and cause DNA damage, and the stuff cannot come out and
present itself as
cervical cancer. And they won't even know there is cervical cancer, because most women, they just notice that they are bleeding more than normal, vaginal bleeding, or they're having abdominal pain and all those things, they will think it's their normal menses. And some women that perhaps they stopped menstruating 3 years ago, 2 years ago, and all of a sudden they started menstruating again, they will say, oh, my menses has come back. No, menses come back. Once you have stopped menstruating, menopause has setting, you have stopped. If you see
any other thing apart from that is a problem.
Exactly. If you now start seeing blood, don't say, oh, thank God it has come back. Me, I don't even want it to go before, and I menstruated for 1 year. Or you're having this vaginal discharge that is smelly, and you don't often have that. You can say, oh, maybe it's infection. Sometimes before you think it's infection, you actually think it's more than infection. And I'm even talking to a practitioner that will say, oh, don't worry, it's just an infection. Go. You may need to do and check more. Perhaps it's not just infection. This is a sign telling you that there's something going in that service that's going to cause problem to this woman later on. So it is not that it's silent. It's misconception, the people's view about it, and people not wanting to talk about these things. Do you understand? So it is preventable and it's curable. That is also something about it. If somebody should detect cervical cancer stage 1, stage 2, stage 3, stage 4A, stage 4 has A, B for cervical cancer. As at stage 4, if they still present, it can still be cured. The early stage 4A. So stage 1 to 3 is confirmed curable. Like you treat it, you cure it, and that is the end. Just like anti-malaria. Use it for 3 days.
So cervical cancer is curable.
It's curable. Stage 1, I'm not saying stage 4 is not. So let's clarify. Stage 4 is not. But 1, 2, 3 is different from all other cancers that they have cancers and you're not sure that the person is going to live or not. Do you understand? But for cervical cancer, that person can be cured. 1, 2, 3. Once you go through the regimen of treatment. And that's that. So cervical cancer is something that people need to be aware of. You see bleeding, you're having abdominal pain, foul smelling, you need to present so that we assess you, stage it and treat it and cured. Like bam, no issue any longer.
Now, which brings me to the conversation around women knowing their cervix, because one of the reasons why a number of women go for so long without going for treatment check, and before you know it, they stage 3 or stage 4 cancer. It's because they don't even know what's going on.
And knowing the cervix starts from screening, and that is the preventable part. When we say cervical cancer is preventable, it means that once you check, once you do screening, you can actually prevent it. So screening starts from first we do vaccination for people that are not sexually active, because it has been said that people that have not had virgins or people that have not had any sexual intercourse hardly develop cervical cancer. That was seen among the sisters that that dedicate their life to God and they won't have anything to do with men. Okay, so they hardly 99.9 of them don't have cervical cancer. So we know that HPV gotten through sexual intercourse and every other means is the cause. So ladies that are virgins, especially from age 9 to 14, and boys too, because boys too can be a carrier and also pass it down.
So boys need to also get vaccinated.
Exactly. So
but we don't talk about that.
So if we don't talk about women. Yeah, because that's exactly the point. When it comes to health and health related, it's only few men, it's only few guys that take their health seriously. Most men, they will go and come and check their BP, and you are seeing 170 and you say nothing they happen, I will come tomorrow. But women are not I don't want to die. So the health seeking behavior of women is commendable. But most men, they don't, until the thing is like, guy, go to the hospital. And even before they go to hospital, they first go to one babalawo or mamalawo or herbal concoction, to do that. So boys and girls need to get vaccinated. 9 to 14 is very potent around that age. Why? Because we believe that they are virgins. We also believe that they should not have had any sexual intercourse like that. So the next question is, okay, so I'm 25, I've not met with anybody. Does that mean I can't get vaccinated? Yes, you can also get vaccinated at any age if you have not had any sexual intercourse. For people that have had sexual intercourse and now say, oh, what's going to happen to us? I mean, I only married one man, slept with one man, and so can't I get vaccinated? The same to the husband too, that is only one woman. So you can also get vaccinated, provided that you do HPV DNA test. That is the test that we check whether one has the HPV virus already in the blood or not. Do you understand? So that lets you know, because the goal of vaccination is to ensure that person doesn't have that thing. before you vaccinate them. Do
Now,
you understand?
a number of times when we talk about cervical cancer,
Yeah.
the test that is so much thrown around is the pap smear
Yeah.
for women. But
That's
since
one.
we've been having this conversation with
Yeah.
you've been about HPV DNA. HPV DNA. What is the difference?
Between
And
pap smear and
yes,
HPV.
and
Okay.
why are you so all about HPV DNA?
It was because you asked me a question concerning those things. That's why I mentioned HPV. If you ask me something, as you ask me about pap smear, I'll tell you about pap smear. So HPV DNA is just a test to know whether somebody has
The virus.
the virus. Pap smear is not to check whether somebody has the virus. No, pap smear is checking whether the person has the virus and is already manifesting in the service. Do you understand? The way one does pap smear is that you take a sample from the cervix, that's the door of the womb or the neck of the womb or the mouth of the womb, through the vagina. They do that. They take it, just a swab, and they go and check it. On that, when they check, the result comes out and lets you know that, oh, the cells that are here, they are abnormal cells, or they are normal. If they are normal cells, we tell you come back in 3 years. And that is also done for people that are sexually active. You don't do pap smear for people.
So the pap smear doesn't necessarily tell you what is wrong, but just tells you there's something wrong.
Yes. No, it tells you what is wrong if something is wrong.
Oh.
So the pathophysiology of cervical cancer is that, as I said, if you take like 10 to 15 years before somebody come and manifest cervical cancer normally. But these abnormal cells already growing in the cervix. So what the pap smear does is to pick what level, what stage. So the way it works is that we have what we call CIN1. CIN1 means cervical intraepithelial neoplasia 1.
Wow.
It shows that the cells that is abnormal here is just mild type. They are just about to transform. Then we have 2, then we have 3. Then we now have carcinoma in situ. We now have cancer. So that stage is stage 1, stage 2, stage 3, stage 4. Before you get to stage 5, that is now full blown cancer. That thing, if one is able to do pap smear will tell you the stage 1 is whether you are in cervical CIN1 or you are in CIN2 or you are in CIN3 or whatever it is. Even if it's carcinoma in situ, that way carcinoma in situ is not full cancer here, it's just on the skin. That way we treat it and that person is cured. So the person will never have cervical cancer, and that is the goal for pap smear. Pap smear prevents one from developing cervical cancer. Whereas HPV DNA is a screening to know whether the person has HPV or not. One can have HPV and nothing will happen till the person dies. The person will never have issue.
Depends on the strain.
Exactly. Now you are getting
Yeah.
that one. You are brilliant. That one depends on the strain. But the pap smear is trying to check that whether the pap smear will not even tell you the strain this one has. It will only tell you the transformation that is happening in the cervix of this person. And pap smear is for women. You don't do pap smear for men. But HPV DNA can be done for both men
And women.
Do you understand?
No,
So
for the HPV DNA, what exactly do you need to be submitting to the lab?
it's just blood.
Your blood.
Yeah.
Okay. All right. Okay.
And it's available. It's available. It's accessible. Vaccination is available. It's available in government hospital and private.
No. Say that again.
Vaccination is available in government hospital and private hospital. I mean,
So what government hospitals should you go
normally
for?
you get it in primary health centers. But if you cannot get it in primary health center, you can at least get vaccinated in Lagos University Teaching Hospital.
Can you get tested there?
You can get tested. You can also do the test. You can do pap smear. You can do
Is it free in government hospitals? That's another question. Is it free?
Yeah.
You can hear that HPV DNA, they can tell you
It's 150.
Yes,
It's 150.
150K.
Yeah.
Wow.
So look at 3M to 100K to 150K. That is something that is preventable, and that's why we are talking about the awareness. The goal of the awareness, because having the treatment does not mean you're leaking vitamin C. The treatment is crazy.
Let's talk about that. You're an oncologist.
Yeah.
How do you treat it? What does it entail?
My sister, I in fact I really commend all cancer patients all over the world, in Nigeria, anybody, and even the relative passing through cancer. Is a sober thing when they present to the hospital. It's not that what you are vibing about, you are happy about. It's a diagnosis that even while we are saying it's curable, they don't want to hear anything not talk of cancer. It's not something, even the society, they say, the person has cancer, they stigmatize them. They don't want to come near them. And the people that try as much as possible to come near. They are afraid that, caring for these people, I'm not going to, contract something from them. So for cancer guys, these guys are area. For people that even lost their life, maximum respect to them. So in treating cervical cancer, knowing fully well that it is curable, first is to present to the hospital and have a positive mindset. Okay, and to treat it is very simple. We do radiotherapy, we do brachytherapy, and that's what we do majorly for them. Some people will say, "Oh, what about surgery? I want to do surgery." Now, it's not really encouraged for patients to go through surgery, because if you do surgery, you still need to do radiotherapy and brachytherapy. Whereas you can do just radiotherapy and brachytherapy without surgery, and you'll be fine, except some type of histology. So rectal cancer has different types also. Right, so cancer naturally have different types. There are some cancer that they are mild type, and some cancer that they are very aggressive type. So it's when patient present, you now say, "Oh, this type that you are coming with, this is squamous cell, this is mild type, this one is adenocarcinoma, this is bad." These are terms you don't need to.
But how do you even tell the difference? Stage 1, stage 2, 3, 4.
Yeah.
What are the symptoms? How do you tell the difference, and how do you treat them?
So whenever patient presents with histology report of cervical cancer, before they will even have histology report of cervical cancer, what happens is that they have symptoms. Maybe after 1 year, most of them after 1 year, and they are like, "Oh, this blood that is coming out is just disturbing me. When it's tired, the menses will stop." It's not menses. If you have stopped menstruating, you need to. And if you're having flow, like that woman with the issue of blood for 12 years, perhaps the woman has cervical cancer, Yeah.
So continuous flow.
Yeah, you're having continuous flow. It's not stopping. This is not normal for 5 days thing, or 3 days.
How do you know abnormal? Is it when you have 7 days, 10 days?
The lady will know abnormal, because you're normal. Cervical cancer does not just happen to 20-year-old lady. It's commoner among ages of 45, 55 and above. So for the first 10 years of your life, the way you have been having your flow. All of a sudden, let's assume you are doing your flow maybe 3 days or 5 days, 3 to 5 days, and you know that towards the 5th day the flow goes down. But this is the 9th day, the flow is still the same. You had it the first month, you had it the second month, you had the third month. Something is wrong. Like, something must be wrong. So just present in the hospital. It may not necessarily be cervical cancer, of course. It can be fibroid, it can be anything. But the point is that present in the hospital. By the time the gynecologist is checking, they will know which one it is. Now let's focus it. If it's going to be cervical cancer, if at all it's going to be cervical cancer, and they take a biopsy of the cervix, because they will examine, they will check, they will do some scan, they will know, "Oh, there's a mass in this cervix. Mass is not supposed to be there." They take a sample of that, they take it to lab. The pathologist checks it and say, "Oh, the cells we are seeing here, they are looking like cancer cells, and this is what it is." So that one, they will grade it. This one is grade 1, grade 2, grade 3. Grade talks about how aggressive this cancer can be, and also tells you how this cancer can run and spread to the other part of the body.
So can the symptoms can the symptoms be the same across the grades?
Yeah.
It could just be even for grade 4 and grade 1. It could just be the same
symptom: bleeding, or foul smelling, or discharge, vaginal discharge.
And if you don't go and present yourself for test, you won't even know that the thing is growing.
Yeah, exactly. And so the grade just tells you how aggressive this thing will quickly grow. Like, if it's going to take 1 year for something to grow, grade 1 will probably take that 1 year to grow. Grade 2 will not go to 1 year before it's to up to maybe size 10. Grade 3 will probably take like 2 months to get there, and that will also determine how they spread. So, but that one is not a big deal. Whatever the grade is, for doctors to know how they will manage it. But the stage comes in when they present with that histology report. We ask them to go and do scan. What are we doing in that scan? We are checking the chest CT scan to check whether this thing has not gone to the lungs, it has not gone to the spine of this patient. We check the abdominopelvic CT scan or even MRI to check whether this thing has not gone to the liver or to the kidney, to the pancreas, or to the ovary, to any part of the body aside the cervix.
But when you talk about to the spine, I just want to be
the cancer cells, the cells in the cervix is different from the cells in the ovary. The cells in the ovary is different from the cells in the womb. The cells in the womb is different from the cells in the vagina. Is different from the cells in the eye.
I understand.
Our body has different cells known to them.
The question I have is that what do you mean by it's going to the liver? What does this cervical cancer? What does it look like? How does it move? Is it that it grows wings
so
and it spreads?
It's not like it grows wing and spread, like disappear. So it's just a mild way of saying that that's a very cancer that one is in that mass. Blood goes inside it and pick the cells inside the cervix. The cells that are supposed to be just in the cervix. The blood that goes in pick some of the cells which are cancer cells, and by the time the blood move around the body, it can deposit it in the liver.
Wow.
So by the time one is doing scan, the radiologist will be telling you that we are seeing something in this liver. Somebody that's not supposed to be in this liver is here. Is likely coming from this service. You understand? And that will tell you that, oh, this thing has spread. That means it has moved. So they move not by flying or disappearing, they move through the blood, or some move through the lymph node. There's a part of our body we call lymph node. Okay, it's a conversation that we cannot finish, but it's a very interesting conversation that people need to be aware of day in, day out.
Outline on Lagos Talks 91.3. I am Olaoluwa Aware, the news lady with Dr. Glow. And we've been talking about cervical health. And I know at some point we touched on how it is important for you as a woman to know your cervix, you know, to know. I'm more interested in that. For me, this year is all about self-awareness. So how well do you think women really know their cervix?
I don't know how to answer that question. I don't know. By most women perhaps don't. They focus more on, don't let me be judgments, but I don't know how well they know their cervix. The only thing we can talk about is that this year 2026, do something for yourself. If you're sexually active, just go for pap smear or colposcopy check. Just check. Go and say gynecologist that I want to check. I want to be aware of my cervix. They will give you the list of things you need to do. And if perhaps you have kids, or 9-year-old or 11-year-old boy or a girl, teenagers, teenagers, or take them to the hospital. You want to prevent this thing that we've heard about. What can we do? Talk to. Most of the screening part is done majorly by gynecologists. This is when it is now full-blown cancer that is sent to us. They sent to oncologist.
Now, talking about this vaccination, do you have an idea of what it costs right now?
The cost of vaccination in government hospital now, I can't be giving exact price, but it's in the range. So give or take maybe 30,000 per dose. So the way we give the vaccine, we can give the vaccine twice. So there are 3 types of vaccine, depending on the type. So we have what we call bivalent, quadrivalent, and Gardasil 9. And so what it means is that first one is 2, the second one is 4, and the last one is 9. So if you want to get vaccine, that is, you just want to take care of 2 strains, 6 and 11. That is bivalent vaccine. It's not really, and that one is mostly given to only ladies. But we have what we call quadrivalent, which can be given to both male and female, boys and girls. And that is 4 subtype that they can give, and they can give that 3 times in a year. Within 1 year, you can have it 0. You can have one in January. In 2 months' time, you have another one. Then 6 months from January, you have the 3rd one. Then there's what we call Gardasil 9, the one that takes off many strains. You can also have that one. So it's given, and per dose roughly maybe 30,000, worst case 50,000 per dose.
All right.
2 months interval, 6 months interval. I don't think it's and it will take care of 90 to 95% of HPV that one is going to be exposed to later on in life. The goal of it is that not everybody that has HPV will have cervical cancer or penile cancer or anal cancer or any other cancers. No, our body immune system naturally fights this virus. Okay. But it's when one is weak, or when one is down, or when one is immunocompromised. So for the person that is immunocompromised, that has HIV and has HPV, the likelihood of developing cancer is higher compared to the one that doesn't have HIV. The person that's given birth multiple times, or that was exposed to sex at early age, or that has multiple sexual partner, will likely develop cervical cancer compared to the one that doesn't have multiple sexual partner. So there's a way all that thing works. So those are the risk factors that is also associated with cervical cancer. So all those things are what determine whether one is going to develop cervical cancer in the future or not. But naturally, our body immune system, so instead of waiting on that, there's a vaccine that can actually work on that. not just relying on your body system. The vaccine ensure that you build antibody, you build a soldier down in case one has HPV. Once it comes in, the soldiers in the body are ready to attack anything HPV. They're already there.
All right. So for the men, apart from getting vaccinated early,
they should use condom.
Oh, that's another way to
prevent. Yes. There's no
cervical cancer in women.
Yeah, use condom. Once they use condom, there's no transferring because the HPV is likely in the sperm. So use condom.
No, because some people feel like the using of condom is just for HIV. They feel like
it's for a lot of things,
and they feel like it's also just to prevent pregnancy.
Which is that's a lot of things: HPV, HIV, hepatitis, anything. Yeah, pregnancy included.
All right. So there's also one I heard somewhere, one of the very common sign of cervical cancer would be pain during sex.
Yes, we call it dyspareunia. Yes, that can happen. That's another symptoms. These are the symptoms that something is not right. Some people think it's infection. Yes, it can be infection, but it can be PID, that's pelvic inflammatory disease, but it can also be cervical cancer. There's even another one that we rarely talk about, but it's important that we mention it. That thing, like some women can develop endometrial cancer. Endometrial cancer, this endometrium is the wall of the womb. We have womb. The wall of that womb is called endometrium. Women, especially those that have stopped menstruating, develops endometrial cancer, and they present almost the same way like cervical cancer. So somebody is checking your cervix and nothing is in the cervix, but you're having all these symptoms. Perhaps it's endometrial cancer. You may need to do CT scan to be sure that there's no mass in the womb. So, but that one is still for another day.
All right, another day will come. Yeah. But then let us talk about this HPV vaccine. For if you get HPV vaccine maybe early or thereabout, do you still need to screen from time to time? Or you can just, once you have the vaccine, just go and rest and do whatever you like.
So the vaccine is not 100%.
Why are you laughing?
It's not a license to explore. No, it's not 100%. You just ensure that you build body antibodies enough to fight such. Something about
it doesn't mean that you still can't get it.
Exactly. It doesn't mean one cannot get it, but the chances of getting it is lower compared to the people that don't have it. That is
because your body is better equipped to fight it.
To fight it, exactly. But it doesn't mean, because if you have 10 soldiers right now and we have like 10 bandits, they fight. 10 soldiers will kill 10 bandits. If there's a reinfection, like the person is now going on sexual escapade, you have multiple sexual partners, your partner also have multiple sexual partners, you are going on
tour.
10 soldiers with 100 bandits, with 1,000 bandits, with 10,000 bandits, they will overwhelm.
Wow.
They understand. So the HPV can create like 10 soldiers around your body. I mean, just little thing you can take care of it. But by the time you expose yourself to multiple risk factors like early pregnancy, early sex marriage, multiple sexual partner, or having STDs, HIV, immunocompromised, that will overwhelm even your body yourself. Not your body, the patient's body, and that can. So it's not a license to. It just reduces one's risk. So it will be wrong to say once you have the vaccine, there's no cervical cancer. No, that will be wrong. Do you understand? But it just reduces the risk of developing it, and that is better. Do you understand that than developing it later in life?
All right, thank you so much, Dr. Glow, as we wrap up the conversation today on the cervical health. I know that in the case of vagina, we've lately, in the past like 10 years, we've learned new ways of, knowing the vagina, taking care of the vagina. Are there things that you feel like people really don't pay attention? Just general things that people should do, shouldn't do to ensure that their cervix is in good health?
So it's like every other part of the body. Cervix is also part of your body that you need to take care of, and one of the ways to take care of it is to take care of your health. When somebody is smoking, you reduce your immunity level. It will affect your cervix. People that drink alcohol, people that are involved in risky behaviors.
Now, what do you mean risky behavior? risky sexual behaviors. Okay.
So those are those things that is indirectly not taking care of their service. But if you don't involve yourself in smoking, alcohol, risky sexual behavior, or any other thing, you eat balanced diet, you build your immunity,
You drink water.
you drink water,
Mind
you
your business.
exactly. Everything, as you're looking good, believe me, your service too will be looking good, because it's not what you can see. We can't all see it. So it's connected to the normal body. So once you know you are doing fine, every other thing in the body will do fine. So
I hope after this conversation we perhaps now know our cervix better. Now we know what to do right now. Thank you so much, Dr. Flo.
Thank you for inviting me.
For your time on Healthline today on Lagos Talks 91.3.